Hello, everyone. I'm very happy to connect with the hospital fraternity. Dear doctors and medical professionals and practitioners, I'm MK Anand from Sea Change Consulting. I'm a strategic business advisor from Sea Change Consulting. I've been in the industry for last about 30 years now, 22 years of consulting experience. I've been largely working with healthcare industry. Organization like Sipaka is one of our premium client. We have been serving them. Not only just serving the Sipaka, which is a number one rural ICU service provider. We also help their partners, partnering hospitals as they call, in Tier 2 and Tier 3 cities across India. So normally when I visit hospitals of Tier 1, Tier 2 cities and towns of India, I found that many of the hospital owners or the promoter of the hospital is a doctor by himself or herself, and they are very busy in their own individual practices, could be ortho or could be general medicine. The biggest challenge they encounter in recent days is very pertinent, that is footfall. There are a lot of clinics, a lot of doctors, a lot of hospitals, clinics mushrooming in every city and town because we are all evolving as a society. So the medical care is, largely penetrated in every single nook and corner of the rural India. Hence, the footfall for the existing hospitals, which are reasonably established over years, found a lot of difficulties in getting the patients in. Once the OP patients walk in, they also have to be, based on their problems and challenges, they've been guided to take them into an IP. So the footfall is the biggest challenge. Once the footfall happens, automatically hospital knows how to really take care of the patients and save their lives and things like that, which is the clinical side of the part. But the management perspective, the business development perspective, the professional practices where, first of all, they must get walk-ins. This is the biggest challenge. They may have a lot of infrastructure. They would have invested a lot of money in building up their internal infrastructures like CT scan and cardio, angio, and so many stuff inside the organization, operation theaters and all that. But unfortunately, all the investments which hospital is making inside the hospital are not publicly known to the general public of that area. Let us say 50, 100 kilometers radius. So this is the biggest challenge. So there comes the penetration of communication, of taking the internal infrastructure to the common man to understand and perceive. Just not about saying that we have the bigger facility, bigger infrastructure, but what is that he is going to get benefited out of this. So those communication gap is largely I found in many of the hospital, which directly impact the footfall of the hospital. So bringing footfall is one of the primary motive in which we are all working. And in fact, Sipaka works very tirelessly in taking just not about their ICU services to the rural India, but first of all, building the ecosystem of the hospital. Only when the hospitals survive, the other services can be offered to the patient. So, how do we make the hospital survive in the competitive environment is the strategy. That is where what we call strategic business advisory for hospitals came into existence. So we have been doing quite a lot of stuff in various parts of the country, and I would assure you that if you can connect with our management team, we will be able to first meet up with you, spend some 1.5 hours with you on a Zoom call, and explain you what are all the ways and means you can actually build your ecosystem to bring more footfall to your hospital. Once the footfall comes in, automatically patient care can be improved through your clinical expertise. You are all very good in your clinical expertise, but the lacking is what I found from a management and business perspective is developing the business model. And unless you do this, what happens is the other side of the story is the more and more drop of footfall, which is actually being bifurcated and it goes into many hospitals. Obviously, the revenue model shrinks. When the revenue model shrinks, the operational expenditures are anyway high, which is increasing year after year. You will not be able to feed the OPEX with the limited revenue that you generate. Obviously, one day what will happen is the hospital, brought down to a very, very minimal, the basic, like what you started 30 years ago. Maybe after your generation, it may not even survive. I'm sorry to say this. This is a time the labor, that work that has gone in for the last 30, 40 years in different hospitals. This is the time to really scale the business, survive, stabilize, and then scale the business. This is where we come into picture. Connect with us, and we will try to help you out in what we call 360-degree approach. Just not about business development, also the clinical expertise in terms of building the SOPs, in terms of building the organizational structure, bringing HR, bringing professional management, leadership, a whole lot of system which anyway corporate does in other part of the businesses. So same thing can be brought in for hospital also. End of the day, food, hospital, education, basic necessary for any human being, and you are doing a noble service, human service to the public, and it is our duty as a strategic business advisor to support you whatever the best we can. And being a micro, small, medium enterprise expert over the last 2 decades plus, I am here to serve our countrymen, our hospital owners to the best of my ability, and my ecosystem partners and alliance services providers. So let's connect each other and explore the possibility for mutual growth and possibilities. Wish you all the best. Good day.